Breathing is essential. We need our lungs to be healthy. Sometimes our lungs can get sick. Tuberculosis, pneumonia, and bronchitis are 3 common lung infections. They can make it hard to breathe. It is important to know the difference between them. This way, we can get the right treatment. These illnesses share some similarities. They all affect the respiratory system. They can cause coughing and breathing difficulties. However, they are different illnesses. They have different causes. They also need different treatments. Knowing the differences can be life-saving. It helps us take care of ourselves better. It also helps us understand when to see a doctor. This essay will explain these differences in detail. We will look at the causes, symptoms, and treatments of each illness. We will also compare and contrast them. This will help you understand these conditions better. Tuberculosis, or TB, is a serious infection. It is caused by a bacteria called Mycobacterium tuberculosis. This bacteria usually attacks the lungs. However, it can also affect other parts of the body. TB spreads through the air. When a person with active TB coughs, sneezes, or talks, they release tiny droplets. These droplets contain the bacteria. If a healthy person inhales these droplets, they can get infected. The symptoms of TB can be subtle at first. They may include a persistent cough, sometimes with blood. Other symptoms are fever, night sweats, weight loss, and fatigue. Doctors use different tests to diagnose TB. A skin test or blood test can show if a person has been infected with the bacteria. A chest X-ray can show if there is damage to the lungs. A sputum culture can confirm the presence of the bacteria in the phlegm. TB treatment requires a long course of antibiotics. Patients usually need to take antibiotics for 6 to 9 months to completely kill the bacteria. Drug-resistant TB is a serious concern. It requires even longer and more complex treatment. Pneumonia is an infection of the lungs. It affects the tiny air sacs in the lungs called alveoli. These air sacs become inflamed and may fill with fluid or pus. This makes it difficult for the lungs to transfer oxygen into the bloodstream. Many germs can cause pneumonia. Bacteria, viruses, and fungi are the most common culprits. Pneumonia can also be caused by inhaling food, liquids, or vomit. This is called aspiration pneumonia. The symptoms of pneumonia vary depending on the cause and severity of the infection. However, common symptoms include a cough with phlegm or pus, fever, chills, shortness of breath, and chest pain. Doctors diagnose pneumonia by examining the patient and taking their medical history. They may also order a chest X-ray to look for inflammation or fluid in the lungs. A blood test or sputum culture can help identify the cause of the infection. Treatment for pneumonia depends on the cause. Bacterial pneumonia is treated with antibiotics. Viral pneumonia is usually treated with rest, fluids, and over-the-counter medications to relieve symptoms. In severe cases, antiviral medications may be prescribed. Section 4. Exploring bronchitis. Bronchitis is another common respiratory illness. It affects the bronchial tubes, which are the airways that carry air to and from the lungs. Bronchitis occurs when the lining of the bronchial tubes becomes inflamed. This inflammation narrows the airways and makes it difficult to breathe. Bronchitis is usually caused by viruses, but it can also be caused by bacteria, irritants, or other factors. The most common symptom of bronchitis is a cough. This cough may produce mucus, which can be clear, white, yellow, or green. Other symptoms include chest congestion, wheezing, shortness of breath, and fatigue. Doctors diagnose bronchitis based on the patient's symptoms and medical history. They will listen to the patient's lungs with a stethoscope to check for wheezing or other abnormal sounds. A chest X-ray may be ordered to rule out other conditions, such as pneumonia. Treatment for bronchitis usually focuses on relieving symptoms and supporting the body's natural healing process. Rest, fluids, and over-the-counter cough suppressants can help manage symptoms. In some cases, doctors may prescribe bronchodilators to open up the airways or antibiotics if the bronchitis is caused by a bacterial infection.